Hello, viewers. You are welcome to another exciting episode of Youth Empowerment Series. Today, we have a special doctor joining us for our discussion this afternoon. Our guest for this afternoon's discussion is Dr. Nana Ama Banks. She is a fellow of the American College of Physicians. She also holds a postgraduate diploma in diabetes. She's the founder of the Diabetes Youth Care Program. Dr. Barnes will be telling us more about the Diabetes Youth Care Program shortly. Dr. Barnes, you are warmly welcome to our program this afternoon. I have heard a lot about the Diabetes Youth Care Program. Can you tell us about this, your special baby? We want to know more about it and see how we fit in.
Okay, great. So thank you so much, Dr. Sheila. Thank you for setting this up for us. And I just had a few things that I wanted to share to make things easier for us to know what diabetes youth care is. If you can see my slides, that would be great.
Right.
So Diabetes Youth Care is a support network for young people living with mostly type 1 diabetes in Ghana. And so our aim is more to bridge the gap between these young people with diabetes and the medical personnel, because we want to provide education, medical support. We want them to be in a situation where they lack nothing so that they can reach their fullest potential. I'll talk briefly about the structure, then we can talk a bit more. So we have a board of directors, and I'm the executive director. And the young people, we call them T1D warriors. And so they are the ones who we guide them, and they form the executives and then the members. So we usually say we are registered non-governmental agency. We registered in Ghana in 2012 formally, but we started, activities around 2010.
Right.
And so this is what we do: monthly meetings, advocacy, home visits, mentorship programs, annual camps, educational assistance, and some medical assistance. Yeah.
Right.
Where are we located? Upper West, Volta, Greater Accra, Ashanti, Central, and then the Western region. So basically, this is about diabetes youth care in a summary. So, we can talk.
So it's a support group. It's more of a support group for the young ones
living with type 1 diabetes, mostly type 1, but we have in recent times, because we have type 2 diabetes, we have a number of young people living with type 2 diabetes who are part of the program. So it's a registered non-governmental NGO in the country.
Nice. I see. So what inspired you, because this is priceless what you are doing, what inspired you to take up such a project? Because it's a one.
Yeah, so it's more of, I say it's who inspired me. And it's more of who inspired me than what inspired me.
Right.
Who inspired me? His name is Isaka. So I was working as a house officer, stress house officer in Kolebu Teaching Hospital many years ago. And then we have admissions, and one of the admissions was a young boy with type 1 diabetes. Now he was 11. And he should have been in the pediatric unit, right? But confusion, pediatrics are like, he's too old. We are like, he's too young, because I was in the internal medicine department. And so with all this confusion, he came to us, our department, and he was lying in the bed. And then my professor at that time was Prof. Nikwe, male Prof. Nikwe. He said, Dr. Barnes, please take care of this patient and make sure that he doesn't miss one day of school. And I was like, that's a responsibility. This one statement was not, it was a very heavy statement. It's like, I didn't know much about type 1 diabetes. I didn't know. I was like, so how do I take care of this boy in such a way that he doesn't miss one day of school? So I researched and I realized that we had nothing even in Kolebu for type 1 diabetics, young people. We didn't have adolescent clinics for them. So he was taken care of. I gave him my phone number. He went home, and anytime he came for follow-up, I made sure that he didn't go to the main OPD, but I saw him on the ward. If I was not around, I'll just ask any of my colleagues to see him. And so that's how it started. And when it started, I was like, why don't we have something for kids? It doesn't make sense. Adolescents, why don't we have something for them? So just when I was planning to do something, I was transferred to Efia Kwanta in the Western
Yeah.
region. So, which was a blessing in disguise. So I went to Efia Kwanta, and then when I went there, I realized that there were 3 or 4 young people in the same situation. So I talked to my medical director at that time, Dr. Ntodi, and I said, can I take one day off the week, maybe a Saturday, and use one place and use it for education for young people with diabetes. So I approached 2 of the kids, and they were like, "Oh, very excited." They were more excited than I was. And so we started like a little group where I started talking to them about diabetes, and then we decided that we wouldn't let them join the adults clinic, but we would support them Saturdays in the morning, come for 2 hours, learn about diabetes, and then go home. And so that's how it started. And then the Accra, Isaka was still being seen by my colleagues because I had left. And then he called me and said, "You are starting something in Western. You've forgotten about me." I came back to Accra, and then I talked to a lot of my colleagues, and then they were very happy with it. So we started it as an NGO, and that's it. It's been 13, 14 years. It's been growing, and we have more than 300 young people living with type 1 diabetes in our group.
Wow. And this is across the country, right? Or
across the country.
Across the country. Yeah. Wow. That's a good one, because I can imagine young people or a young person with diabetes coming to the hospital and have to spend the whole day joining the queue before the stress of the sickness, and also the stress of even staying in hospital the whole day can be a double slap. So this is something that takes maybe part of the burden, huge burden from them, so that they don't even miss school. That's
exactly. So that was the whole point, so that you don't miss school, and so that you are in a situation. You know how Ghana, we are very, how should I say, very concerned. So imagine a young child going to a diabetes center. The old people are like, "Hey, what's your diabetes? And so they felt the stigma was so much for them that they did not want to. So a lot of them would not go to the clinic. But when they had a separate place where they had their own colleagues, they could meet them. It was like an exciting time for them. Hey, I have to go to the clinic. Hey, I'm going to meet this person. I'm going to meet this person. So it was more encouragement for them to go to in a non-judgmental place where they could meet other people and, just feel free. So that was it. Yeah, that was the main thing.
So currently, do you still have their clinic for them separately at the various regions?
So yes, so I know that Dr. Elizabeth Banker is currently the board chair of DYC, and so in Rage Hospital in Accra, they have a separate clinic for them.
Right.
In Kolebu, I know that Dr. Tiase with the diabetes, they also have a separate clinic. In our region, they have a separate clinic. In Western region, they try and do a separate. So in some places where I have worked, we try to separate them so that they feel, comfortable. If we are not able to get a separate clinic, then at the monthly meeting, we do have doctors who see them and make sure that they are taken care of.
Yeah. Okay. So that takes care of that. Yes. It's a good thing. I really hope and wish it can be upscale to the other regions so that they can all benefit, because this will make a huge difference. I'm sure it does. Right. So Dr. Vance, let's talk a little bit about the diabetes itself, the disease diabetes, in simple terms. We don't want the big medical jargons, so that our viewers who are our viewers who are non-medics will understand diabetes in simple terms. So let's take it up.
So when you say diabetes, we call it diabetes mellitus. Yes. Diabetes is sugar. Mellitus, it means siphon. That's the Latin and Greek things. So it's all a problem with sugar, or sometimes people call it glucose. So your body is not able to handle the glucose or the sugar properly. Glucose is very important in our body because we use it for energy. So imagine that you've eaten and you can't get any energy from the food you've eaten. That is because that glucose that is supposed to move from your where you've eaten, your intestine, into your cells where you can get energy, there's a blockage. And the blockage is because of something called insulin. So insulin, you hear a lot of people talking about insulin. So insulin is a hormone which helps for you to take in the glucose, breaks down the carbohydrates into glucose, and then it is used for energy. So anything which interferes with the process of the carbohydrates or the glucose being absorbed by the body will produce diabetes, meaning that instead of the sugars going into your cells, it remains in your blood. And so your blood, when you check your blood, the sugar is very high. And so that is the basis of diabetes, the fact that you have something going on preventing glucose from being sent into your cells. So that makes you talk about the different types of diabetes. And the commonest one in children is called type 1 diabetes. For that type of diabetes, their body does not produce insulin at all. And so it's like zero insulin. Type 2 diabetes, your body produces insulin, but the insulin is not effective because there's a problem down the line. Then type 3 diabetes is also called gestational diabetes. It's usually seen in pregnant women. Then there's a group of, I won't talk too much about, there's a group of other type 4 diabetes where it could be caused by medications, it could be caused by certain diseases of your pancreas. Those are called type 4. Just recently, WHO has come up with a new one called type 5 diabetes, which they noticed that in developed countries is due to malnourishment, is due to poor development. Then their bodies do not produce the insulin. So it's not an autoimmune disease at all. So just for everybody's simplicity, just know that in diabetes, there's a problem with your insulin, which is causing you not to be able to absorb your glucose you need for energy. So in the midst of plenty, you are hungry. Exactly. That's basically it.
Exactly. In the midst of plenty, meaning there are a lot of glucose in the blood, yet the cells are starving. A lot of glucose staying in the blood, yet cells are starving. Right. I think we understand this very well. Thank you for simplifying diabetes for us. So let's look at the causes and risk factors of diabetes.
Okay. All right. So the way I talked about it, you see that the first type of diabetes, which is diagnosed mostly in children, we call it, that's a type 1. We say it's an autoimmune. Auto means self. Immune is like your immune system, which fights diseases. So unfortunately, in type 1 diabetes, your body finds the organ which produces the insulin, which is the pancreas, to be a foreign body and goes to attack it. We don't know why it happens. So it's like your body goes to fight the pancreas and destroys your pancreas, and then you can't produce insulin anymore. We don't know why that happens. It just happens. And so at the end of the day, their bodies don't produce insulin. In type 2 diabetes, usually it's a problem at the end stage. Your body produces insulin, but when it gets into the cells to work, it doesn't work properly. Causes could be either poor lifestyle, weight gain. Not everybody who is fat has type 2 diabetes. Note that. It could be weight gain. People who are even slim can get diabetes. It could also be your lifestyle, not eating properly, not exercising could do that. And then sometimes medications can do that. In people who get gestational diabetes or pregnancy, they've realized that some hormones in pregnancy would increase your risk of getting type 2 diabetes. And that's what you find in pregnancy. They don't really know why. So those are the risk factors. Type 1, you can't do anything to prevent it. Type 2, to some extent, you can. And they've realized that type 2 runs more in families, meaning that if somebody has type 2 diabetes in your family, there's a higher risk of you getting type 2 diabetes as compared to type 1 diabetes. So type 2 diabetes runs in families. That's why you have to make sure that your lifestyle is good. Type 1 diabetes just happens. Two people could have a kid who could have type 1 diabetes. Just because the two have type 1 doesn't mean that their children will have type 1 diabetes. It's just that type 2 is higher. If you have your parents have type 2 diabetes, you're higher risk than if your parents have type 1 diabetes of getting diabetes. Yeah.
Right. So let me ask this question that is commonly asked by lay people. People think eating a lot of sweets or sugary food. This one, I'm sure if I don't ask, my my viewers will be thinking, what do you say about that? Eating a lot of sweet or sugary food can let someone develop diabetes. What do you say about that?
So that's a false statement. It's false because sugar is just one little part of carbohydrates. Eating sugar would not cause you to have diabetes. It's a lot more than just sugar. It's a whole lifestyle of eating so many things, carbohydrates. Our carbohydrates that we have, unhealthy carbohydrates, that is it. But not eating sugar, no. But when you get diabetes, we don't want you to be eating these sweets. So that is it.
Great. Thank you. Thanks so much. So what are the signs and symptoms? How would someone know that he or she is developing or maybe has developed diabetes?
The first thing is they have weight loss.
Weight loss,
unexplained weight loss. You are eating so much, you are still losing weight. The second thing would be urinating a lot. So it's like, every time I'm going to urinate, 2 seconds I'm going to urinate, and I'm always thirsty. So sometimes in medical terms, we call it polydipsia, polyuria. Polydipsia means poly, you're drinking so much water. Yeah. Then polyuria, you are urinating all the time. And for children, we realize that we diagnose them, let's say they should have stopped wetting their beds, but then all of a sudden they start wetting their beds again, no matter what. And they're always drinking water, they're always thirsty. So those are the ones, usually type 1 diabetics, when they come in, they are small, they've lost so much weight, they look cachectic, that's the word. They look like, it's not kwashiorkor thing. It's like malnourished. It's more than kwashiorkor.
Emaciated.
Emaciated. Yeah. It's very bad. And then the moment they start insulin, it's just amazing, the transformation. How within a week or two, they'll gain all the weight back. Wow. So type 1, that one, it's sometimes disheartening that when you realize that you lose someone because, just insulin would have cured them. So the most things is you're drinking a lot of water, you're urinating so much, you're losing weight, you're tired all the time. Sometimes you have blurred vision. Those are the main things. And so that's for type 1 diabetes. Type 2 diabetes, usually in the adults, is very difficult. They may have a bit of, drinking a lot of water, urinating a lot at night, but the symptoms are not as drastic as the ones which are type 1 diabetes. So most of the time, a lot of people would have type 2 diabetes for months or years, unless they go to the doctor. But the type 1, it will hit you so fast, you would have to be going, you'll be taken to the hospital to check. Yeah.
Wow, nice. So, but in the case of the type 1, that is common in children, right? Type 1 is common in children.
Type 1, so 95% of type diabetes, it's type 1 in children. In adults, it's mostly type 2. 95% is type 2. Yes.
Right. But we can have some adults with type 1.
Oh, yes.
That means they would have had it from their childhood, is it?
No. So we have adult onset. We call it latent onset diabetes, type 1 diabetes, where after the age of 40, some people can develop autoimmune, like type 1 diabetes.
Yeah, right.
It's also an autoimmune. Yeah, latent onset of type 1 diabetes. Yeah.
Great. So let's look at some of the complications of diabetes.
So it's really sad. Anytime I think about complications, I just want to cry because it's such a sad thing that we still have it. But let's say we have the acute complications and the chronic complications. Acute meaning that it happens within a short time. The commonest one in the acute within a short time is hypoglycemia. Hypoglycemia means that your blood sugar drops really low, and that can be really dangerous. And I've seen people like literally have a seizure and die from it. And so we want your sugars to be low. We don't want it to be down. So those hypoglycemia, and then the other one is what we call DKA, or sometimes people go into a coma. And we see that in newly diagnosed people. So they would have come in because their sugars are so high and they didn't know it, and they go into a coma. So that's DKA. So those are the acute complications. What we talk about a lot more is the chronic complications. So diabetes affects every part of your body, from your head to your toe. So let's start with the eyes. It can cause blindness in your eye. It can cause something called retinopathy. These are all poorly managed. This is not you have diabetes equals that. It's when you don't manage your diabetes properly that you have that happening. Okay, so eyes, blindness, cataracts. Okay, and then you go to your hands and your feet. It can cause something called nerve neuropathy. You get anansi, pins and needles, especially worse at night. Okay, your heart, numbness. It can cause high blood pressure. It can cause heart disease. It can cause strokes if it's not managed well. Tummy. Sometimes people don't eat properly, and so it can cause something called gastroparesis. Your body does not break down, and you are full all the time because you're not eating well, and your nerves are not causing the food you eat to go down properly. Okay, and then kidneys. The commonest thing which is killing a lot of our kids is kidney failure. I mean, we only have 2 kidneys. Once your kidneys are gone, they are gone. So, and we don't have facilities for dialysis. So I've lost a lot of patients to kidney failure. So that's one major thing that it is. And then for the males, it can cause erectile dysfunction if it's poorly controlled. And some females may get some problems with fertility, not being able to have kids, but it's not very common. If your sugars are managed properly, you should be okay. So those are the complications. So from head to every part of your body is affected. And then there's an increased risk of infection. For the females, they get a lot of these vaginal infections, white. If a patient, and then boils, if a patient comes to me and tells me I'm getting boils and I'm getting vaginal candidiasis white, I know immediately your sugars are not well controlled.
And the peripheral neuropathies too can affect the feet, right?
Exactly. So your hands and your feet, you wake up, they feel when I slept, I couldn't. It was like I was walking. When I walk, it's like I'm walking on cotton. I feel some burning and some prickly sensation. Yes. So your hands and your feet.
And there's this thing about poor healing of wounds in diabetics. Can you throw a little light on that? Because it's quite
Thank you so much. Yeah. When we're growing up, we associate diabetes with having an amputation. So I think that's what a lot of the kids were like. They're like, oh my God, I have diabetes. Is my leg going to be amputated? So that was the main thing that we were. So thanks for that. So in diabetes affecting your heart and your vascular, and your nerves, what happens is that with a neuropathy, you don't feel. So I've had patients who are like, I don't feel my toes well. So they'll get a sore and not realize, I mean, let me tell you, pain is very important. If you don't feel pain, there is a big problem. So they get a sore, they don't feel the pain, and then the sore just, let me tell you, sugar, diabetes, bacteria loves sugar. So your sugars are poorly controlled, you get a sore, the sugar there is plenty, there are a lot more bacteria there. So your wounds will not heal properly because the bacteria is there. No matter how many antibiotics it is, it wouldn't heal well. And then with the nerve damage, it's not going to heal properly. So, and most people, because it doesn't pain them, if it's not painful, we go to the hospital. They will end up soaking it in water or hot water that is even damaging your feet. And by the time most people come to the clinic, the feet or the wound is dead. And so that's why we used to have a lot of amputations with people with diabetes, because they will not report to the clinic early, not because of any fault of theirs, but it wasn't painful. And so by the time they get to the hospital, the doctor had to say, oh, we have to cut your hand, we have to cut your leg. And so we always associated diabetes with having an amputation.
No, fortunately. So that's why we usually advise diabetics to wear footwear, protect their feet. Because I remember when we were in medical school, we were told of a story that sometimes people will be walking around, maybe step on a nail, the nail will be stuck in the feet and they are not even aware. And this nail will be there because they don't feel the pain and they'll be working with it. So I think the education has to go
that
on.
is so true. Yeah. Thank you so much for that. Remind me about that. It's the foot it's mostly the type 2, is the foot problem. So it's like people go and walk, think that, oh, a carpet, there's nothing there, but somebody might have left a pin on the carpet, and then you go and you on it. So it's like, for our people with, I mean, I did a lot of type 2 diabetes education when I was in Ethiopia. We had the adults. Foot care is like when you look at your face in the mirror every day. Get a mirror and look under your feet every day. That was like standard. Every day you watch your face in the mirror, take a mirror, look under your feet. Just make sure that everything is fine.
There's nothing stuck in there. Yeah, that's true. Yeah. And like you said, most of the time these complications will set in when the sugars are poorly managed, right? When the diabetes are poorly managed.
Yes.
So we encourage our viewers to those who have relatives with diabetes, they should adhere to the treatment, because if it is well controlled, most of these complications will not happen. Thank you. Right. So, Dr. Barnes, we are coming back to diabetes youth care, your baby. I have a little knowledge about it, not a little, I have fair knowledge about your program, your program, your NGO. I know you usually have annual campaign, right? I know annually, getting to the end of the year, you usually have some kind of campaign or conference for these young ones with diabetes. Tell us about that conference. Is it coming on this year? And when is it coming on?
It's coming on this year. So I'm sharing the slides. This is like a camp that we do. So the camps, we started them in 2008, 17. So these camps we get young people living with type 1 diabetes from all over the country to come in, meet together, have fun, and we do various things. So we usually we started with 3 days, and the kids were like, nah, it's too small.
It's too small.
It's too small. So they said 4 days. And you don't realize how much it is, a lot of work. So we start on a Thursday and end on a Saturday. So this year we're actually going to do it it's going to be class. So I'll give you the details about it. But what we do is that we bring these young people together, and it gives the parents a little bit of respite, because then, they get some respite. And so in this camp, what we do is we do a lot of the kids meet each other. They talk a lot. We also educate them. So every camp has a theme. We've done eye care, we've done mental health, we've done managing complications. You can see the kids, they have so much fun. It's just to make sure that they just have fun. I mean, at that point in time, they feel like this is us. Let go. And none of them pay for it. And so we usually raise funds. And so that's the thing. We raise funds from people. It takes every kid it costs about 500 to 600 Ghana cedis to house them, to feed them, because every time we are checking their sugars, we are making sure that they're injecting their insulin, we are feeding them healthy meals, and we have doctors, nurses, pharmacists, and even non-medical volunteers joining just to support, because it's a time where it's just for them to have fun, for them to feel free, and for the parents also to, get some. It's like, now I can get 3 days to rest and not have to worry about my kid. So we do it every year. We had it last year. Last year was a mini camp. We did it in the Ashanti region. And 2 years ago, we did it in Kaswa. And this year, we're going to do it in Kaswa again at the Pentecost Center. And so we are appealing for donations. I'm going to give you out. I think I have the poster with details, which I will share with you also. So
great. So what's the age range for the children you receive for camping?
So the age range, we actually have, so it's from 0 to 30. If you are more than between 23 to 30, you become something called a mentor. You take care of the younger ones, because we put them in groups, and then we want to make sure that somebody's taking care of somebody's eyes or somebody. So it's usually 0 to 30. But if you're from 23 or between 23 to 20 to 30, when you come in with responsibilities. You're not going to come in and behave like a kid. We'll give you responsibilities to do. If you're newly diagnosed, that's different. For newly diagnosed, we sort of will guide you. But if you are already been diagnosed for more than 2 or 3 years, you have to be a mentor to join. So 0 to 30. People who are between the age very young, less than 10, some of them come with their parents. And so we only allow one parent if possible. But I have some of them who trust the doctors enough where they are like, oh, I'm leaving my child in your care. That's fine. Yeah.
Did you say 0?
Yeah. So 0? I have babies. I have babies with type 1 diabetes.
Yeah, but you receive them at the camping. Do you receive them?
Sometimes the parents want to learn, and I'm not going to stop. So sometimes it's for the parents who want to learn. I'm not going to stop if somebody. The youngest we've had so far, I mean, we haven't had that young, but I would say maybe a 2 or 3 year old. Yeah, and then they came with their big brother, big sister, or the parents. Yeah.
Okay, that makes a lot of sense. That makes sense, because the parents or the guardian will learn about diabetes.
Exactly.
And that will improve the care they give to the person at home. So what you're having at Kaswa, you're going to have people traveling all the way from the north, everywhere across the country to come, those who want to come.
Exactly. So that's why it becomes a cost expensive. It's quite expensive. So wherever you are, the people because we don't want to, why should we disenfranchise somebody because of where they live? And it's also an opportunity. Some of them have never been to the southern Ghana before. The last 2 years ago, we did it. The kids from Upper West were so excited.
Yes.
And then the kids in southern Ghana, they were so excited to meet their colleagues and learn more about them. We have like a WhatsApp platform for those who have, to interact, but to see each other in person puts a different light on everything. So that's what we like to do.
So their transport is usually, they take care of their transport, right?
No.
Oh, you have to still take care of their transport.
We pay for everything because what's the point in doing that and not, we pay for every single thing. So that's why it's like if we ask somebody, if we ask someone coming from the north, they might not have the funds to be able to make it. And so we organize a bus. We have a doctor, we have a nurse on the bus.
Who come with them?
Public transport. There are 10 or 15 of them. They have somebody checking in on them, and then they come in and we take care of them. So we pay. It's like that's how. Otherwise, if we ask people to pay for transport, some people will not be able to make it.
They will not be able to. Honestly, they will not be able to. Wow, this is great. God bless you. Honestly, God bless you. And I can imagine this will be an occasion these young ones will always be looking forward to.
Oh,
like annually, I can't wait
for the past. Yes, they've been disturbing me. As the camp coming on, when it comes to October, November, the number of calls I get from the parents, it's like,
I know, right? and you can't stop, because I'm sure the year you don't organize it, that will be a lot of they will not be happy. They will not be happy because they are looking forward to an annual event where they will come and meet their friends, learn, of course, and also have fun. Have some kind of refreshment from their own region to a different region. It's a good thing. It's a good thing, and you need all the support, honestly. I would also encourage our viewers, our cherished viewers, to support this noble cause, Diabetes Youth Care. Let's support this noble cause, because to put a smile on the faces of our young ones, it's a noble one.
So we have our bank accounts. I put the details. This is one of our colleagues who's trying to raise 50,000 for the kids, Dr. Banker. And so I put the contacts there, plus our EcoBank account, our Momo, for Vodafone Cash, and then EcoBank Express Pay. We have all these accounts. So I'll put them there. But the phone, so that you'll be able to make the contacts and then make the donations. No amount is too small. I mean, your 1 or 2 or 3 or 4 or 5 Ghana cedis may help, somebody with transportation to come here and there. So I'll put it in so you can,
Right.
you can pin it. Yes.
We'll pin it. We'll pin it to the description section after the recordings. Thank you. Viewers, let's try and support our young ones. Let's support them. We'll do that. Dr. Barnes, well done. Well done to you and your team.
No, thank you to you. You have been amazing. You volunteered with us before, so thank you. We really appreciate you. You've really helped us and supported us, and we really appreciate this.
Thank you. So we're at that point that we want you to give our young ones some encouraging words or some words of advice for these young people, those with diabetes, those without diabetes. Anybody who is young will benefit from your encouragement.
I think one thing I've learned in life is don't give up. It's very easy for us to give up when trials or barriers come our way. I see every day as a challenge. And so don't take it as a time for you to be disheartened, but see it as an opportunity for you to learn and improve yourself. When a situation comes, you can either make it negative or you can make it positive, or you can totally ignore it. I think that no matter how bad or how good it is, always look for the best in it and learn from it. Be open to feedback because it's what improves you. A lot of us can't take feedback because we take it personally, but see it as a time of growth and a time of opportunity to get better. So that when the 360 days to that day, that feedback or that what negative thing that came to you, you use it as a stepping stone, but not as a drop off to make yourself much better. So that's my form of encouragement.
Thank you. Thank you so much. We have taken that because honestly, it's not every feedback that will be positive. Some feedback will come to us as a negative feedback, but if we sit back, sit down, reflect, analyze it, we may see some advice in it and use it to progress. Thank you for that encouraging words. Viewers, we have come to the end of another episode of Youth Empowerment Series. I believe we've all learned a lot about diabetes and the Diabetes Youth Care Program. Thank you for sticking and staying with us. Share this video with all your contacts. And don't forget to subscribe to this channel if you have not yet done so. Turn on your notification bell so that when we post any video any day, you will see to check up on it. See you soon. Bye.